The COVID-19 pandemic affects everybody equally. This idea was often proclaimed in the beginning of 2020, given that a virus cannot discriminate. 2.5 years later, it has been shown that the pandemic is exposing and exploiting inequalities even further. Around 15 million people across the globe have died in the wake of the COVID-19 pandemic. The unreported number might be much higher. Not all lives were lost directly to the virus. Most of them succumbed to other diseases and injuries due to the overload of health systems. The COVID-19 pandemic is not only a global health issue. The virus has exposed, fed off, and increased existing, often intersecting inequalities of wealth, gender, race, and other dimensions. Negative impacts include widespread job loss, inadequate or missing labor rights and social protection policies, increased gender inequality, domestic violence, widespread school closures affecting children and youth, just to name a few. Many of these issues have affected marginalized groups, like Black people or indigenous communities, especially people living in poverty, disproportionately. Billionaires' fortunes returned to their pre-pandemic heights within just 9 months, while the recovery of people living in poverty could take over a decade. If countries addressed the reduction of inequality immediately, poverty would return to pre-crisis levels within just 3 years. Even though there is no vaccine against inequality, a vaccine against the virus exists since the end of 2020. Phrases like "no one is safe until everyone is safe" were pleas to global solidarity to prevent a protraction of the crisis. And today? Vaccine inequality, some even speak of vaccine apartheid, still leaves millions of people at risk of severe illness and death. To better understand the current situation, let us have a look at the data. This map shows the number of COVID-19 vaccine doses distributed per 100 people in each country of the world. The dark green implies that the supply situation is adequate and that booster shots are widely available. The light color means that the access to vaccines is severely limited. If we take a closer look at Africa, the second largest continent by size and population, we see that just 15% of the adult population has been fully vaccinated by now. Only 15.9% of the people in low-income countries have received at least one dose of a COVID-19 vaccine. Take a look at this graph. The red line stands for low-income countries, the dark blue one for high-income countries. The space in between demonstrates vaccine inequality. Some might argue now that vaccine inequality already is a matter of global attention. Indeed, COVAX, the worldwide initiative to ensure global access to COVID-19 vaccines, distributed its 1 billionth dose this January. However, this means that COVAX has achieved only half of its target of delivering 2 billion doses by the end of last year. The German pharmaceutical company BioNTech now plans to supply modular mobile factories for the self-sufficient manufacturing of mRNA vaccines to Rwanda, Ghana, Senegal, and South Africa. Nevertheless, non-governmental organizations like Oxfam criticize BioNTech's initiative for being implemented too late and for ensuring that vaccine patents remain in the company's control. Instead, they demand the extension of local production capacities. Human Rights Watch and Doctors Without Borders have found that at least 100 companies in countries of the Global South could potentially produce mRNA vaccines against COVID-19. In March of 2022, results from negotiations between India, South Africa, the European Union, and the United States of America concerning a temporary patent waiver on COVID-19 vaccines and other pandemic-related technologies and equipment were leaked. These results imply that the global north continues to systematically undermine a global response to the pandemic. Again, it appears that inequality is a political choice.